Hello everyone and welcome to Andrea Davis Cancer Coaching. I'm Andrea and today I'm going to be answering a question from an email subscriber who's wondering if there's anything she can do to ease the terrible joint pain that she's having as a result of being on Aromatase. So today's question and asker is Tanya Brandom. She's 46 years old. Tanya lives in Pendleton, Indiana, and she works as a consultant for an employee benefits company. So she's one of the lucky ones who was already working from home before the pandemic. So Tanya found a painful lump in her breast last July, which turned out to be cancer. So she had a mastectomy. Her margins were clear and no cancer was found in her lymph nodes at the time of surgery. So she'd had some unusual back pain before her mastectomy, and a little while after her surgery, she finally went to the ER because it was so painful. And at that time, a CT scan showed cancer in her spine and pelvis, as well as a couple of small fractures in her lumbar spine as a result of the cancer. So she had 4 rounds of chemo and 10 rounds of radiation, which improved the pain in her back by about 90%. And on Valentine's Day this year, she got the most amazing news that there's no evidence of cancer in her body. So I want us to take a moment and celebrate that. That is so fantastic. So fantastic. Yay! Yay! So Tanya's been taking Aromatase since mid-February. So as many of you probably know, Aromatase is an aromatase inhibitor, and it's used to reduce the risk of breast cancer recurrence in postmenopausal women. So the problem she's having is that every time she stands up, she has so much joint pain that she says she feels like an 80-year-old woman. So this is a common side effect. Close to 50% of women who take aromatase inhibitors, such as Aromatase, experience joint pain, which is also called arthralgia. I take Aromatase too, and I'm thankful to say that while I had a little bit of stiffness at first, it's completely subsided over time. So now on to things that have been shown to help with this. In a 2015 study published in the Journal of Clinical Oncology, 121 breast cancer survivors who had all reported that they'd been exercising less than 90 minutes a week were divided into 2 groups. And these are all people that were having joint pain. So one group was assigned to do 150 minutes per week of aerobic exercise. So that's about 2.5 hours a week, as well as supervised strength training twice a week. And I put the specifics of the strength training protocol in the resources section of my blog post on this. And there's a link to my blog post in the video notes. So most women did brisk walking for the aerobic exercise, though some chose stationary bicycling. And they did this for a year. And the other group just kept doing whatever they were doing before. So on average, the pain scores in the women who exercised decreased from moderate to mild by the end of the 1-year period. So I'm hoping it didn't take most of the women a whole year to get that improvement, but it didn't say either way in the study. So the women who exercised also experienced measurable benefit, kind of not surprisingly, to their heart and lungs and to their upper and lower body strength, and many of them lost some weight too. And for the group of women who did not exercise, the joint pain actually increased and got worse over the course of that year. So because Tanya had these spinal fractures, her strength training will need to be professionally supervised. So fortunately, when she and I talked on the phone, she told me she has some really good options for that. And if any of you out there want to try this and don't have fractures, there are some training videos that are offered for beginners by HasFit or Heart and Soul Fitness. Probably good to check it out with your doctor before doing this. But I'll put a link to one of their videos in the resources section of my blog post. Something else that's been shown to help women with joint pain from aromatase inhibitors, besides exercise, is acupuncture. So in a study of 226 breast cancer patients that was published in 2018 in the Journal of the American Medical Association, patients were divided into 3 groups. So one group had acupuncture treatments for 12 weeks. Another group received the same amount of a placebo acupuncture, which is designed to not really do anything. And then a third group was a control group that didn't get any treatment at all. So the women who got the real acupuncture had less joint pain and stiffness after 6 weeks compared to both the sham acupuncture and the control groups. And the decreased pain and stiffness persisted throughout the intervention. So I do want to mention that their pain wasn't fixed or cured, but it was decreased. So if I were in Tanya's situation, I'd probably go for both the exercise and the acupuncture. It's quite possible that a person would get better results by doing both. And I just wanted to say that when I mentioned the acupuncture to Tanya, she told me she knows of an oncologist who also does acupuncture and would feel very comfortable getting treated by that person. So that's fantastic. I looked up some foods that are claimed to help with joint pain from taking aromatase inhibitors, and the one that has the most science behind it is tart cherry. In a double-blind clinical trial that was conducted from 2016 to 2018, it was found that patients who drank 1 ounce of tart cherry juice concentrate in 8 ounces of water every day had a 34.7% mean decrease in pain compared to 1.4% in the control group, in the placebo group. So that's really significant. And Tanya told me that some women in a Facebook group she's in have had some success taking a tart cherry supplement, and this is something that she's going to try along with exercise and acupuncture. So, just to recap, things that have been shown to help with joint pain from taking aromatase inhibitors are exercise, and in the study it was 2.5 hours a week of exercise and then 2 sessions a week of supervised strength training. And acupuncture, I think it was 6 weeks, there was treatment twice a week, and then 6 more weeks treatment once a week. And tart cherry juice, and Tanya's going to be taking a tart cherry supplement, so has also been shown to help. I hope you found this helpful. Thank you so much for joining me here. Please like this video and post a comment to let us know what you thought. Stay up to date about my latest videos by going to AndreaDavisCancerCoaching.com to sign up. And if you want to find out how cancer coaching can benefit you during and after cancer treatment, send me an email at AndreaDavisCancerCoaching.com with the subject line, Interested in Coaching. Thank you so much for joining me here today. Please take good care of yourself until next time, and I will see you soon. Take care. Bye-bye, everyone.